Well, thank you everyone for joining us today. We are bringing you another session of Voices of Healthcare Cloud. We're really excited for the content that's going to be shared. But before we get started, let me go over just a couple of housekeeping items. We want you and encourage you to participate in our discussion today. And all of the questions that you post in the chat will be moderated. So if they need to be private, we'll keep them private. But if they're great questions, which we know they will be, we'll post them to the entire audience so everyone can see our answers. At the end of the session, we will post the recording and any content that was shared. So definitely check out our blog to get the recording to share with others, or if you missed part of it, to catch up on the content. So how do we engage? You will notice at the top right-hand corner, there's a little question mark. If you click on that, it will open up the Q&A panel. Will look like this. And then we just have a live chat. So go ahead and start practicing now. Announce who you are, what city you're coming from, and what organization you represent if you care to disclose that information. So let's get on to the presentation. What do we have for you today? Today, we have three amazing presenters. We're excited to bring Josh Thompson, Maria Curion, and Serini. Josh and Maria are going to be talking about a vaccine bot solution that is great for your internal staff, your internal employees. And then Serini, formerly a Microsoft employee, now an employee of Andor Health, is going to talk about a similar solution that Andor has to offer, but can be for internal employees or for the general public, your patients, or even just folks that aren't in your EMR to get registered for vaccine appointments and help with the distribution of your vaccines. So with that, let me pass it over to Josh to talk about the employee version of our vaccine bot.
Awesome. Yeah, thank you, Shelley. I know I've been a guest a couple of times on here, but just to introduce myself, so Josh Thompson, and I'm a customer success manager in healthcare. So my role is really helping organizations innovate with the Microsoft technology that they have. And before we jump into this employee vaccination solution, and I think that's important to understand that this solution is really more geared towards employee vaccinations. It'll be followed by Serini's solution, which is an example of a more public or patient-facing vaccination solution. But I want to talk a little bit about where this employee vaccination solution came from. It's been really amazing to see how organizations have been trying to digitally transform and use Microsoft's technology to rapidly innovate in response to things like COVID-19 and now vaccinations. And in work that I had done with some of my customers, I found that there were a lot of common themes with what they were trying to do. And so we had many organizations that were trying to use forms and Power Automate and bookings and teams for a lot of different things related to vaccine communication, as well as, and probably more importantly, the actual scheduling of those vaccination appointments. But they were challenged, and we as Microsoft received a lot of feedback that these organizations needed to manually connect the dots. And so there was a lot of work going on behind the scenes to connect the forms and the Power Automate to bookings, and then from bookings to whatever the data source was, and formatting that data in a way that was reportable back to the state or the county or whatever. And so we, as just a team within Microsoft, tried to undertake that and say, how can we streamline some of this process much more? And so what we did, and what we're going to show you here in a minute, is we actually created a chat bot that's built on the Azure Bot framework. And so that means that the bot can be placed anywhere that an Azure bot can be placed. But one of the ways that we've packaged this up, we've actually created it as a Teams application. And so it's a chat bot that employees can access, directly from within Teams. That bot leverages the Q&A capabilities of, within the bot framework to do some of the basic questions and answers to collect employee information. But then we actually used a bookings API integration to bring, as you can see here in this image, bookings calendar information directly into the bot experience. And so you don't have to click out and go to a separate experience. People can actually see, based on the dates that they select, what are the available time slots on the calendar for them to sign up for. And then, as we'll show you, we've even kind of taken that a step further to automate the scheduling of the second vaccination. And so at a high level, that's really what it is. That's what we're going to show you, and that's where it came from. We've gotten really positive feedback so far, so we're excited to show you the bot now. And so you could see here the vaccination scheduling bot that's available on the left rail of Teams. And so if you're not familiar, you can actually pin various applications to that left rail of Teams, including things like chat bots and other applications, whether they were Power Apps or other things. And so for easy access and sort of natural advertising, we have pinned that bot to the left rail of Teams. And you can see Maria has started to interact with that bot, and she's woken it up, so to speak. And keep in mind, all of this can be customized and changed. The language, the logos, the flows, the branching. And so there was a legal disclaimer followed by now, hey, what hospital are you working in, or what subsidiary of our organization are you in? And then, asking for, first name, last name, email, phone number, and that contact information, so that your organization knows how to get a hold of the person. And so the bookings calendar appointments can be emailed out to those individuals. And so now we'll go through things like date of birth. So do you actually accept a COVID vaccine? And Maria, if we could just pause there for 1 second. As we go through some of these questions, it's natural to want to create some form of branching, where maybe you have a group of employees that don't want the COVID vaccine, at least not right now. And then you can see it, we start to get into questions around, hey, do you have any of the following health conditions? And depending on the answers for those, you may want to have those employees break off into different paths and have them go down, a different, ask them a different series of questions. And so that customization is absolutely possible within this this Azure Bot framework. For our purposes, we're just kind of walking you through the the kind of skeleton experience of the bot. And so now it asks for height and weight to calculate BMI, and all of these things are part of the CDC guidelines to try to measure the risk. And now here, Maria, I want to pause for just a second. So once we get through those initial triage questions, this is where we say, okay, now let's schedule your vaccination based on your responses above. We want you to, go ahead and to schedule that first vaccination appointment. And so here, the individual can pick a specific day. So we've picked the 28th of January, and we hit that send button and give it just a second. But what you'll see happen is it will hit that, when you hit that send button, it will actually right there populate different times. And those times, so you can see there's lots of different options, in this case, it's a demo environment. But on the back end, before releasing this bot, you can create that availability based on your organization's bandwidth. And so whether you want to offer 30-minute appointments or 15-minute appointments, maybe you want to put a cap on the number of people who can schedule for any one of these time slots. And so we can walk you through that a little bit and show you that. But here, those time slots are just surfacing within the context of the chat for an individual to pick and choose. And so here she's picked 8:30. And then you can come out here and you can see the bookings calendar that has been created on the back end to manage all of these bookings appointments. And so ahead of time, you can create this calendar. So right here, she's going to go out to a different calendar. We have one for the first shot and another one for the second vaccination. And so you're able to see those bookings appointments on those calendars. Oh, sorry, I think there was a delay in our response there, so it restarted us. And again,
yeah, sorry, I think it timed out, so I'm just going to start again, if that's okay.
Again, it's demo environments, but we can walk you through this process one more time. And so as Maria kind of walks through that, once that that first date and time is decided on by the individual, they are given a slot on that bookings calendar, and they will get an email notification saying, hey, here is your date and time, and it'll be blocked off on that bookings calendar. But then something that people have also found really helpful is based on which vaccine you have, you can say, okay, I want them to schedule the second vaccination. And so you'll see now she's scheduling, as she schedules this first appointment. Now it'll say, hey, your second appointment, in this case for the Pfizer BioNTech vaccine, we need to schedule that 21 days from now. Please confirm if this slot will work for you. And so it's 21 days later, just by default at the exact same time, so that they can just do an easy yes or no. And so in this case, we've said yes, and it creates those appointments for them on the booking calendar. And so now coming back here, you can see for the first vaccination, there is that slot that Maria just signed up for. And so there you can go in and you can look and say, hey, we've got 25 available slots so far. 20 people have signed up for this slot. And you can see who those people are and everything else. And then as those slots fill up, they become unavailable for people to choose in that chatbot experience. So if you have 25 slots at 8:30 and now Maria is person number 25, that time slot will no longer be visible for people to select in the bot. And then it's the same thing where we have a second calendar, and you can see that here as she goes and she searches for the second calendar. She'll click out to it and it will take her to totally separate calendar. You'll go and be able to find that she has that second appointment scheduled. So all of this, the goal here is to streamline and automate this process as much as possible, and to make it as easy to manage as possible for your organization. So with that, I know I've seen a number of different questions that have popped up in the chat. And so let me take a quick pause, maybe Shelley, and you can help me guide and direct me and see if there are any immediate questions that we can address.
Yeah, absolutely. So it looks like a couple people missed the opening. So would love just a little bit more on the intro of kind of where why the bot was created and how they possibly could deploy it in their environment. A lot of people are asking if it's pre-built, that they can drop it in, or is this something that they would need to customize on their own?
Yeah, great question. And so to just answer that for any who maybe missed the first part, where this came from was just from our healthcare organizations and customers who are really trying to innovate with our technology. And so we saw a lot of organizations that were using things like Teams or bookings or forms or Power Automate or other things. And they were kind of manually connecting the dots. And so it provided us with an opportunity to try and innovate and to streamline those processes, which we did by creating this bot. Because it's built on the Azure Bot framework using the Azure Bot Composer, it can absolutely be customized. And so if you wanted to use it for something other than vaccines, or if you wanted to create different paths, for people to go down based on the answers that they provided to different questions, you can absolutely build and customize that. And maybe Maria, if you don't mind, could you add any additional detail there? And maybe between you and Shelley, we could also share some of the, in response to that question on, hey, is this a template, or is there, something that we can kind of share for organizations to quickly implement?
Yeah, sure. Thanks, Josh. So we do have a zip file of the Bot Composer bot as it's, which was demoed today, that can be shared with our customers, and we can help certain customers to deploy that, even customize it in their environment as per the needs. So all you need is an Azure subscription to host the bot, an installation of the Azure Bot Composer, and of course the Teams package, Teams app, which is how we've packaged this whole solution.
Awesome.
And one other thing I'd add to that is we are working on creating a template for this that we can release publicly, but today that has not been fully approved just because we are developing very quickly. So if you need that or want that information, either message us in the chat and we'll engage with your account team or your customer success manager to help get that information for you. And then, of course, once it does go live, we'll post it on the resources on the blog. We do have another question that came through about reporting. Someone was asking about, let me make sure I read it fully. Is there a way to get a total number of appointments that were set up via bookings? So any kind of reporting capabilities.
Yeah, so we can talk about some of the reporting capabilities. And so just at a high level, that information that is input to the bot is shared with, onto a SharePoint list, which, if any of you are familiar with SharePoint lists, that information can be manipulated in many different ways. We know that that there are requirements in certain states, and it's really dependent, from state to state on, how that information needs to be shared or reported on. And so here you could see this SharePoint list experience that Maria is showing, where we've got all these different, names of people, who have, filled out this, who have scheduled their vaccinations. Obviously, it's a fake environment, but all that information can be manipulated. It can be exported into Excel. It could be, any number of things to be shared. Let's see. So I'm looking at, yeah, go ahead, Shelley.
Yes, another question, which I'm trying to respond in chat as well, but asking a little bit about, can it tie into the vaccine brand or lot number, knowing that different brands of vaccines require different frequencies of appointment scheduling and things like that.
Say that one more time. Oh, go ahead, Maria.
Yeah, I mean, you can customize it. Like this is just the demo piece where we just chose the Pfizer vaccine, but for the Moderna, that period would be different. So we can change the time period and even have maybe even a drop box on which is the vaccine that the person selects. So that's doable.
Hopefully that makes sense. Steve, who asked that question, happy to take that more if you have further questions around that. A couple other questions that came in. Yeah, what about scheduling the second dose? Does this track when the patient is due for their second dose or proactively reach out to them to schedule that? So I think the bot actually addresses that. Maybe we could show how it automates the second appointment again.
Yeah, Maria, do you mind just bringing up the, just sharing your screen one more time, and we could just show that experience. And so you can see here, the way that we've built it just by default is because, you know, the various vaccines, they have recommended timeframes to administer. They, you know, in this case with the Pfizer vaccine, it's best 21 days afterwards. And so the default that's just kind of built into the bot for ease of use is to say, hey, 21 days from now at the exact same time you booked above, we want you to schedule the second vaccine. And so it's helped us just kind of simplify that process. But if you were to use a different vaccine, you could adjust that window. And you know, if somebody were to say no, you know, you could, hey, I've got a conflict at 8:30, but you know, 9 o'clock would work for me. You can absolutely do that as well, so that they can go through that scheduling process for the second vaccine in a way that works for them.
Perfect. And another question was about that first and second appointment. What kind of confirmation, communication, or reminders does the employee get once they book their vaccination appointment?
Yeah, great question. And so they do get an email reminder, and Maria, I saw you kind of mousing over it. You can adjust some of those reminder notifications, but here in the event, so you've got a number of different options to say, hey, I don't want to send an email confirmation, or I do want to send an email confirmation. I want to include a meeting information in that email confirmation. But they'll get that meeting invite just emailed directly to whatever email they've input into the bot, so that from there it can go onto their calendar. And Maria, you may have other details there that you'd want to share.
Yeah, so for this particular service, that's the COVID vaccine service that we've selected, there are certain settings that we can work with. So based on the settings, so if I've enabled text message notifications, then they would get that notifications as well. And similarly, as Josh mentioned, email notification based on the setting that I have for this particular service.
Awesome. These are great questions, so keep them coming.
Yeah, that is all I see so far in the chat. I guess any last minute comments or recommendations for people to get started if this is something that they're interested in leveraging?
I would say, you know, my recommendation would be at this point, would love to have people who are here on this call right now, you know, feel free to, you know, put something in the chat and we can follow up with you afterwards. But for those who are, you know, watching it after the fact, would love to get, a comment on the, the blog post, that launched this, so that we could get in touch with you. We would, and then that way we could outreach that way. Anything else, Maria? You've got, oh, sorry, Shelley. Maria, I know you mentioned the zip file and other things, and there will be additional communication coming out around that in the next couple of days. But anything else, Maria, that you'd recommend as far as outreach goes?
Yes, I mean, I think we've covered it all, Joshua, and we should see a blog post about this bot publicly available soon. So that should help us share more details on how to deploy and work with the team that built it. So
awesome. And we just got one more chat in the window, and it actually is a great transition. So folks are asking if we have any solutions that could be used for public-facing vaccination appointments. And so with that, I'm wanting to transition this over to Srini, who is joining us from Andor. Srini, are you out there?
Let's see, Srini is muted. Are you there, Srini?
There we go.
There you go.
Can you guys hear me okay?
Yes.
We can.
Hey, I'll share my video too. Hello, everyone. Thank you again for the chance. And so I was with Microsoft for quite some time. I've made the transition over to a company called Andor, which is a Microsoft partner. And while at the core, the capabilities of Andor are to be able to bring clinical content into collaboration platforms like Teams and Dynamics and Azure to be able to enable virtual visits, clinical collaboration, virtual rounding, and the like. Today, I'm actually going to, Josh and Shelley, I'm going to share my screen if that's okay.
Absolutely.
What I actually want to walk through with you today is the work that we have done around this vaccine management process. And before we get started, there are a few things that I wanted to highlight. There are organizations that are taking lots of different approaches on how to do this. And then different states are having different processes as well. Some are relying on health systems and some are relying on grocery store chains and others. So it's a very varied process. And frankly, it's a process that's changing every day. And so as we think about this, there are several components that are really important as part of this vaccine management process. And I just wanted to walk through those steps. I'm going to go fairly quickly, and then that way we'll have some time to be able to answer some questions. So one of the key pieces that people are trying to figure out first is be able to identify from a digital front door perspective, whether this is an existing patient of yours, an unknown patient, just a citizen who wants to come for a vaccine, what kind of prioritization you want to layer on. And of course, a lot of the health systems are really focused around democratized access and the ability to do equitable access to healthcare. So it's really not about prioritization by any other other reason than the need to be able to get the vaccine. Once you've kind of done that, then there's the whole notion of two parts of scheduling. There's the scheduling the patient for their vaccination, which could be a simple scheduling app engagement that we have within Andor, or also integrated into the APIs for the electronic medical record systems to be able to schedule inside there if that's the need. But equally, the other part is also what I would call a digital backdoor. So if the digital front door is for the patient and the citizen, there's a digital backdoor that is for actually planning and aligning your clinic shift staff schedule, because these aren't actual doctors. And in most EMRs, schedules are tied to resources, which are doctors. In this case, we're talking about 12 techs who are stood up in a lobby who are delivering vaccines. And so how do you manage those 12 techs? How do you load balance those techs? So we'll talk about the capabilities in our platform to be able to enable that. Then once you've allowed that patient to come into the actual clinic, how do you make sure you're validating this is the person that was scheduled? Are you validating with driver's license? Do you have a QR code process? How do you make sure that the patient has kind of been checked in for the next step? when you do the vaccination, how do you capture the vaccine manufacturer, lot number, expiry date, NDC number, where it was delivered, all the things that are required for reporting to the authorities, as well as plan the scheduling for the second dose. The last piece of this is being able to drive cadence-based notifications, whether that's a reminder to let you know, hey, your shot's coming up, or post an actual vaccination to be able to send a notification in an omni-channel way to a patient to say, are your symptoms severe? And if they are severe, how can we escalate that to referring you back to your PCP to make sure that you get connected to the right follow-up? So all of those pieces are part of this process that need to be managed. And underlying it is this notion that there needs to be a data and analytics platform that can also orchestrate this workflow and then do the reporting, or at least provide the outputs to provide the reporting for the state authorities for those that have been vaccinated. So that's kind of the end-to-end process. And the way we've seen this is in one of two ways. We've either seen organizations that said, hey, I want to define a campaign to a group of individuals who are over 65 who have these complicating conditions, or people who want to present just a unified face on their digital front door, on their website, on their portals, on their apps, to be able to say, if you're interested, come here. And that can lead to a pre-registration or an identification process as vaccines come available. And some lead to a pre-registration, some go straight to actually scheduling this. Once they're scheduled for a time, this could be in the Andor application, or it could integrate into the EMR. They then receive reminders 24 hours before or 48 hours before as you define the cadence. They then get to that first dose. Post first dose, we can also press to them, because we know the symptoms are maximized 3 days after. We can then press to them the update to say, how are your symptoms, to do a symptom check-in. And then the final step is actually helping them schedule and deliver that second dose, and then do the same post second dose follow up on symptoms as well. So that's kind of the end-to-end process we're seeing a lot of organizations follow. And what this looks like literally is this notion that you're coming to your health system website. You're then being able to be pushed over to a very simple experience to acknowledge some information about the vaccine and some basic information, capture your demographic data. And this can lead to one or two routes, either to a PreReg list or directly into a scheduling construct. We're going to go to that PreReg list as an example. So here we have a PreReg list. And so now this health system has basically captured interest from people who say, I want to have a vaccine. After this, then they can, as vaccines come available, as doses come available, they can say, oh, I've got a dose lot of 2,000 that just got shipped to me. I want to deliver this, and I want to deliver this over these days. They can go ahead and enact this list and enable this list to then go out and proactively notify the people who've already chosen their preferred mode of communication that it's time for you to now go schedule. And that go schedule can be a time-bound unique link sent to each individual, so that what you don't want is someone to take this link and then forward it on to 15 other people. And then if people don't sign up, you actually want to be able to action on the next set of pre-registrants. So we enable that capability to do a 4-hour or whatever time-bound limit you want link that allows that unique person to be able to go in and schedule and see availability, choose their location, choose their appointment, and get a confirmation and be locked in for that appointment. Now, if they come to that site post that 4-hour time limit, they'll actually come to something that you could say, hey, we've kind of parked you here. We're going to send you back to our health system's website because we need you to reaction or re-request to be added to the reg list or the next available lot that's coming. And then once they've been added, then you can actually be inside this dashboard. And inside our dashboard, we have the notion of being able to present all of the statuses of all the patients as they're matriculating through this process, to be able to say, here's someone who joined the pre-reg list, here's when their scheduled notification came out, they scheduled their first visit, they completed their first visit, they did their second visit, they came back for the rescheduling of their second visit. We also have the ability in this notion to say, oh, we had a walk-in. We had a certain number of capacity we had set aside for people who are just going to walk into our health system. So we can take the walk-in scenario and have them kind of on demand slotted into schedules that might be available by the clinicians that are working in the clinic itself. And then as people either show up or don't show up, you can mark them arrived. You can say no show. You can say that they cancel the appointment, as well as capture all of the details related to the actual delivery of the vaccine. So we essentially, because we know the lot numbers that are available to you, We can preload all those lot numbers, so you're down selecting as you deliver the vaccine. It's Pfizer, it's this lot number, it's this expiration date. No, none of those fields are manual entry because we've already pre-populated all of those. So you're just selecting from a pre-populated list. So you have this evergreen view of what the schedule looks like, where people are in that process. And then we have two kind of routes of engagement. We can deliver this as a solution that's end to end. We can manage the entire process. And then on the back end of this, be able to push data back into the electronic medical record. Now, this whole vaccination thing brings to health systems this notion that there are people who are coming to your health system to get vaccinated who may never actually come to you on a regular basis. We even have some children's health organizations that are driving vaccines to adults, but those adults who are 65 and older may never go to a children's hospital again, right? So how do you keep that data, but you don't want to necessarily create a record in your electronic medical record with an MRN for every one of those individuals. So we actually offer an opportunity to leverage our platform to deliver the entire end-to-end capability. Or if you have an EMR and you want to leverage our omni-channel instrumentation to be able to do some of the orchestration of this flow, but you want to then avail this through MyChart open scheduling. We can always link into that. We have the APIs to link into all the major EMRs, so we can actually pull all of the scheduling availability, present it to patients, and then have them schedule and push that data into the electronic medical record. Or we can enable essentially this notion that people who are known who have a patient portal account, we can let them schedule through either the Andor aperture or through that patient portal aperture. If they're a known patient but they're not registered in your patient portal, we can enroll them in either way, either help them enroll in the patient portal or present an Andor interface for scheduling. Or if they're a new patient you've never interacted with, we can also help facilitate them scheduling, and then on the back end be able to push the data back into Epic or the appropriate EMR. So really kind of giving you the flexibility to be able to create this process and this patient engagement and management capability independent of how you're trying to correlate with the electronic medical record. What I wanted to walk through is, so we talked a lot on this about the patient-facing side, or what we call the digital front door for the patient. What I actually want to talk now about is the digital back door. Because the other part of this is managing the actual demand of how many resources you have and what locations they're available in, and managing the volunteer sign-up process to deliver vaccines. And so we equally have thought about that side of it to be able to manage the demand or the supply, if you will, of the resources that are available to deliver your vaccines. So we have the ability by location to be able to present shift schedules. And what we've actually heard from healthcare organizations is that they want to vary the throughput between morning, midday, and evening. So in the morning, they may actually do vaccines being delivered every 15 minutes with the same number of resources. But in the middle of the day, they may actually ramp that up to those vaccines being delivered every 10 minutes so they can put more people through the vaccines. And then in the evening, they may want to open it up again to have more space between the vaccines in case there are walk-ins, because they anticipate that the mornings and afternoons or evenings will have more walk-in capacity that they need to be able to code for. So we allow this creation of a shift. We allow the creation of the definition of available resources and appointments. And all of this can be dynamically updated, because if a volunteer doesn't show up, you need to be able to quickly tweak this and say, oh, I only have 9 resources, so now I need to deliver vaccines every 10 minutes instead of 15. So how do you do that on demand? And so our platform allows you to be able to manage that on demand. So you can create a shift, add a shift, change a shift, set up a template. So you can have a template that says every clinic has this morning, midday, afternoon cadence. And so once you've defined this, shift, construct, you can then set it up as a template so that you can just repeat that template. So you might have like a clinic 1 that has 5 resources and a clinic 2 that has 10 resources, and you have this cadence set up, and then you can just replicate those every time you're starting to deliver vaccinations. Then we also enable you to configure the messages that are going in terms of what's being said, what the instructions are, what the links are, how you're addressing the people that are being notified as part of this process. So that's kind of the back-end administration piece. Again, it shouldn't be available for everyone, but this is a small subset of users who would have access to this, who are actually planning and scheduling the the supply side of what's available from a resourcing standpoint to deliver the vaccines. And then there's always the other side, which is the patient engagement side of how this is going to then manifest itself and show up. So, and this is the ability to then say, I've got 12 lots, here are my lots, here's my Pfizer lots, here's my Moderna lots, here's what they look like, here's my expiration dates, here's my NDC codes. So you can pre-enter all of those and have this inventory of all the vaccines that you have. And then based on what you enable for a location, those lots are the only ones that are there for them to select from as they deliver the vaccines. So I kind of just ran through this very quickly, but I hope that kind of gave you a sense for the, kind of what I call the back door, which is for the clinic, the clinician, the admins to set up how these shifts are going to be administered, what days they're going to be delivered on, how long they last, what kind of throughput they're trying to gauge through it, as well as the throttling and visibility to the patients of where they are in the process, what their next step is, timely information, and really enabling equitable access for everyone to be able to get vaccinated. So let me pause there, Josh and Shelley. I don't know if there are questions that have come in or things that we should talk about.
One thing that, Srini, I find really interesting from the conversations that we've had is that this is something different from other organizations. This is something that Andor didn't just develop overnight for COVID-19, but this is building on capability that you have leveraged across, some of your other solutions for years. Can you speak a little bit about that?
Yeah. Actually, I might even bring up a quick slide if that makes sense, to just kind of walk you through what is the Andor capability, because at the core, this is what drives the ability for us to be able to turn the system quickly to be able to adapt. So let me just share this and let me know if this comes across as it should be. But essentially what we've built is that we've built this notion that we want to be able to ingest data from lots of different data sources, both ingest and pushback. So that could be anything from an IOMT capability to all of the EMRs to CRM platforms to other endpoints. And then what we're able to do is able to pull data from all those sources and normalize them across a data platform taxonomy, and then use an enterprise organizational taxonomy to then layer in how these pieces are able to be administered for children's division or a different demographic or a different group. And then we bring this notion of a workflow, routing, roles, and triggers engine. So you can say, when this happens, do the next thing. So when we ingest the data and put it into this data model, we have this ability to be able to stand up a way to be able to action on triggers, define workflows that stand behind that. Then we spin up artificial intelligence, AI, bot, virtual platform, virtual assistants, business intelligence capabilities on top of this. And so when we talk about what is the Andor capability, this is the Andor platform, right? So this platform gives us a lot of agility to be able to say, oh, your workflow is vaccine management. Really, it's no different than a virtual visit. We're just changing different parts of the flow in terms of the workflow. So it makes it really simple for us to be able to, respin this in order to be able to serve a particular use case. And really the value for organizations is that you as an organization can take this platform and leverage it as your platform to be able to build your own clinical workflows on top of.
That is, I think, really, really helpful, Srini, just for people to understand, because, and that's something that's, I think, a cool differentiation, is just that core capability. This is just another application of that, which you've been doing for a really long time.
Yeah, and I just wanted to add, Josh, the one thing I know we kind of connect to any system, right? And you obviously saw that we can potentially connect to a Salesforce, but honestly, what we've done with Dynamics in terms of being able to plumb our data into Azure API for Fire or into CDS to be able to enable like a really deeply connected workflow that goes from care management, knowledge of the patient 360, to then be able to orchestrate discrete events and actions is very unique. So anything we do with the other platforms are very rudimentary, but we're doing a much deeper integration with Dynamics, where the value of the two together is much more than the individual parts.
100%. And to build on that integration, Shelly, I'll let you have a second for questions here in just a minute. But to build on that integration, you touched on this, but there's some really big organizations, frankly, on this call, and I imagine they've got a lot of complex, pathing, and workflows in mind, where maybe it's a pediatrics hospital and they want to target the women and the children of, the population of a city, or maybe it's, another organization that only wants to target a specific, demographic or something else, and the others, they don't really care if they, don't care. They don't want them to create records in their EMR. And so can you talk about, just kind of double click on the level of customization a little bit, specifically with the vaccine management solution there?
Yeah, that's a good point, Josh, because I think a lot of the talk track around the vaccine management has been mostly about equitable access, but certain organizations serve better populations, and so they've been trying to make sure that the populations that most need it, that could most benefit from the vaccine, are served first. And so because, again, the workflow and the triggering notions are just configurable. You can set up the configuration to be one way, and literally the same day, 4 hours later, your governor's mandate could change, right? We just heard today in Florida that the governor's mandate changed this morning from who's going to deliver the vaccines to a different entity that they want delivering the vaccines for the state. So those things happen. They're very dynamic changes. And so we wanted to enable a system that allows people the flexibility to say, oh, workflow changed. We want to flip this. Today, you know what, we're not capturing this information. We want to flip this on. We want to do the direct integration into Epic to be able to push the scheduling information into Epic. Nope, we want to disconnect it because we don't want to capture thousands of data points that are never going to be in our EMR. So it's really very configurable in that way, to be able to do it dynamically, because things are changing like hour by hour, really.
Yeah.
Well, and on that notion, people are asking about reporting. Some states have requirements, others have different requirements. I assume we can report on EMR integrated or out of band, vaccination appointments, but can you validate that and how you guys, work with the reporting?
So we work with the health systems. So we're working with several health systems in Florida and around the country, and we want to map to whatever the state requirements are for that reporting. So we've got a couple of different ways we can do reporting. We capture all of the demographic data that is required, whether that's next of kin, whether that's NDC number, whether that's where the shot was delivered, all of the key components, we always capture all of that. Now, there are two ways. We could either do that as a flat file that we provide to the healthcare organization to send to the health authority, or we can actually push that data into the electronic medical record, and some electronic medical records already have the notion of all vaccination information being sent in an automated way via API to the health boards. We also are working in some states to say, why don't we just take that burden on, and we'll just write the APIs to the health boards that have the open access, so that we can actually report on behalf of that healthcare organization. So we enable any way of doing that, whether they're a known, unknown, or it doesn't matter what kind of patient. We're able to capture that data, either send it to the health system, send it to the EMR to be reported directly via API, or plumb our own API connection into the state health system to be able to report that.
Awesome. So we actually have some folks that are saying this solution looks really good, and they're interested, wanting to know a little bit about timing. Obviously, kind of what's best case scenario, worst case scenario for implementation timing?
Yeah, so we've designed this to be extremely agile and deployed quickly. So just to give you an example, again, we didn't actually have this solution come the end of December. In January, we said, hey, this is a need. Why don't we take this platform, Joshua, like you said, and just turn it to be able to support this need? And so we have the solution fully up and running. We've got a health system that's going live this week. We can essentially support a health system that's interested to be able to take this platform and go forward with it within a week. Now, if we are doing the EMR integrations, we'll need to work with their EMR teams to be able to plumb the APIs and connect and make sure that we've got the HL7 feeds and the other things. So that might take a little bit of time, but the entire Andor capability, we can stand up for a health system in a few days, in a couple days to a week, depending on what the complexity is and what the workflows are that they're trying to enable.
Yep. And we as a Microsoft team, we know that you guys can integrate with almost all of the EMRs, but just for the customers on the call, is there any EMR that you guys can't integrate with?
Well, you know, it's a very complicated question, Shelley, in the sense that, you know, the limitations are not on our side in terms of our ability to ingest data, because we ingest data and push data back on lots of levels, right? So we have native APIs, we use HL7, we use Fire, we use lots of other sources, Data Drop, Data Factory. We do many different ways in which we can pull and push data. A lot of this really depends on whether that EMR allows that kind of API access or HL7 feed access. So there are some limitations. It's largely because there are some EMRs that are very hard to get into who do not allow that access, but we try to work around that. You know, in some cases, in lieu of having a direct API connection, we can do a batch transaction at the end of the day to reconcile. So there are ways that we can work around that.
Awesome. Let's see, if somebody wants to get in contact with you or with Andor to find their representation, you know, what is the best next step other than the Microsoft team being the liaison?
Well, we have actually a way that you can contact us directly from our website. You can reach out to me directly. I'm more than glad to engage our sales team to work with you. And then, of course, I think Joshua and Shelley can also direct you if you were to ask them. And we can get our sales team connected with you, explore the fit, and work with you on how best to implement this. Our notion is to try to make it lightweight both in time, but also lightweight in terms of cost to go deploy this. We know that this is, you know, this is a huge humanitarian effort to you know, get people onboarded. There are some literal costs that we have, so we do have to have some minimal costs associated with standing this up, but we're trying to keep those to a very low minimum, so it's super simple for people to be able to stand this up and get it running.
Awesome.
Thank you, Shelley. Thank you, Joshua. I really appreciate you having me on. Thank you, everybody, for joining. It's good to see you all again, and look forward to hearing from you.
Yeah, absolutely. And we really appreciate everybody from the customer side who joined us today. We have just a couple of minutes left, and it looks like we've covered the majority of the questions in the chat. So let's just take one more look there to see if anybody's comments are that we missed.
I don't see any, Shelley.
Yeah, we do have a couple of customers that have expressed interest in having more information for both of these solutions. So if you have done that, we will definitely be reaching out. And as we mentioned, we will post all of the recording for this, any of the slides or resources that were shared during the live event today on our blog post. You can get that at aka.ms/HLS blog. And please look out for our next month's session of Voices of Healthcare Cloud. We have a couple of topics in mind to present, but with these dynamic times that we live in, we might do an ad hoc at the last minute, depending on what is most relevant and top of mind for the industry. So we do appreciate you guys and look forward to engaging with you again soon. Thanks so much for your time today.
Thanks, everyone.